So now I will request Professor Suhas Kumar Shetty, the Principal and Medical Director at KLE Shri BMK Ayurveda Mahavidyalaya, Belgavi, to deliver his talk. Thank you, sir.
A very good evening to all of you. Following the presentation by the luminaries, I'll do the post-tea presentation. Few of my friends were asking why there was a break. I said that you should take a break before you listen to my talk. We have listened to the previous speakers where they told the various fundamental concepts and various basics of Ayurveda and the basics of Rasayana. So I'll take to the next level where probably I will try to see how we can apply this at a clinical scenario. Being specialized in mental health, so I represent Ayurveda, mental health, and also I represent my institution, which also offers post-graduation in Rasayana and Vajikarna. Only one institution in the country which offers a post-graduation in Ayurveda, Rasayana and Vajikarna, which most of the previous speakers have been talking about, and what we have done at our labs and at our teams and various clinical applications of these Rasayanas I'm trying to share with you. I'll just skip through a few of the fundamental slides because all of them have been covered by the previous speakers. If you look at the previous few years of Nobel Prize, you can see that a lot of them has gone to the concepts of Rasayana, maybe like autophagy, or we are talking about circadian rhythm, or we are talking about telomeres and the lifespan. So you see that the potential that the Rasayana and the longevity has in the area of health research, right? So basically, as you know, there are two things. One is the Rasayana Tantra as a branch of Ayurveda, one among the 8 branch, focuses mainly on rejuvenation, longevity, and the enhancing the quality of life. And Rasayana as a therapy, which mainly is focused on its administration on a daily basis to improve the quality of life. So they are all specialized based on its fundamental aspects. If you look at the actions, how Rasayana acts, it mainly ensures that you have a proper formation of the body tissues. Then we have the metabolic functioning, and of course the microcirculation is how the Rasayana acts. So this rejuvenative medicines or Rasayana is enhancing the physical and cognitive functionings, maintaining the stabilizations, and capable of removing or able to cure the diseases. So, so why basically we would need the application of Rasayana at a clinical scenario? Basically, you see that there's a lot of cell death happening, and that's the reason why there's so much of physical, mental, cognitive impairments happening at all walks of life. And if you look at the what Rasayana can do, you can see it's a multimodal actions that it can do, like starting from the nutraceutical actions, the regenerative actions, the immunomodulatory actions, of course, the antioxidant and the adaptogenic actions. So it has so much of varied action that it can have, that it can apply on a clinical scenario. So it can be a solution for various helpful longevity, prevent the premature aging. It can also be useful for prolonging the longevity, develops positive health, mental faculty, and provides a resistance and immunity against the diseases. See, there are various classification of the Rasayana also based on the scope of its use. Like we have Kamya Rasayanas, which are specific for the vitality and longevity, especially for the mental competencies and for the body luster and the complexions. There are also the organic specific or the disease specific Rasayanas also. As based on the method that Bhushan sir was talking, we have the Vataptika and the Kuti Praveshika Rasayanas. And based on the content, that is not just medicine that we are talking about, it's also the diet, lifestyle, and few of the tissue-based the Rasayanas that we can apply. So at the time when we are looking at the 5P medicines of predictive, preventive, personalized, participatory, and precision medicines, I think Ayurveda definitely can be a very good candidate or leads that we can take in, especially the preventive and the personalized medicines. So we have talked about what Ayurveda can do in terms of how it can decline, no? And we also have tried various single herbs and the compound herbs based on the decline that happens at each of the decade. So, and there are a lot of studies that has been taken place, especially like we have the studies on the ashwagandha, and also we have tried the usage of the rasayanas based on a particular prakriti, like vata prakriti can be given the lashuna, pitta prakriti, amlaki, kapha prakriti, ballataka, vata pitta, kushmanda, pitta kapha, guduchi, and of course the kapha vata can be tried with the haritaki prayoga. And even based on the dhatus also, there are various rasayanas which can be tried and which can be prescribed. And basically these rasayanas act on base three main levels: at the level of the micronutrition, the proper circulation, and of course they say that you get a proper nutritive value by applying this. So ideally this, if you look at the various multimodal actions of Rasayana, in terms of Ayurveda, we say that it is going to cause the nourishment of the bodily tissues, the metabolic activity, the micronutrition, and also it can delay the aging. And this is how the various studies have been taking place about the mechanism of actions like nutraceutical actions, the rejuvenative actions, the immunomodulatory, adaptogenic neurotransmitters. And that is where Ayurveda, it doesn't just speak about the medicines or drugs as such, but also talks much beyond that in terms of the diet as medicines, in terms of lifestyle as medicines, and of course the various medicines and therapies that can be applied. So basically we are looking at the various actions by which this rasayana works, like the antioxidant, and because this is a pathology that occurs, the mitochondrial dysfunctions, the telomere shortening, and various studies have been taken place based on that. And that's the reason why the major scope, or where we also have been working, is on the DNA repair and the genetic stability, the anti-inflammatory and the immunomodulatory effects, and the neuroprotective actions. So there's a strong role that Ayurveda and the Rasayana can play in the antioxidant actions, the anti-inflammatory, and the adaptogenic actions. And it can have the effect on the cellular health, system balance, and the psychological well-being. So I'll just focus on a few of the research updates, especially what we have done in our units, as well as in few of the other labs that have been working on various rasayanas that we are talking about, especially the single herbs like amalaki, guduchi, bringaraja, then we have lower basma, ashwagandha, which has been tested for its antioxidant actions, the immunomodulatory actions, the hemopoietic action, and of course the adaptogenic actions. And also like ashwagandha, vidarikanda, various like basic ghee as well as milk has been studied for its nutritive functions. And also there has been various studies where they have tried on the telomeres, DNA damage and aging, and some of the potential leads that we can get, and we have been trying that both at the experimental models as well as the clinical models. Even various studies that has been done on the single herbs that we are talking about, like guduchi, mandukaparni, brahmi, tulsi, and shankapushpi, which has been studied for its actions, especially on the DNA damage and how it can be helpful in repairing the DNA damage. Not only single herbs, but also various polyherbal combinations which has been studied, and then how it has had an action on various biological functionings. Like we have the Triphala Rasayanas, which mainly has the action on the DNA damaging. Then also the Amlic Rasayanas, which reduces the, especially the damage, especially in the brain cells, that it can promote and it could be a good candidate in cognitive functions, as well as some of the neurodegenerative disorders, especially like Alzheimer's, dementia, where we have been trying this Amalaki Rasayanas. Also the Mamba Rasayanas, which mainly will increase the DNA base excision repair, reduces the clonogenicity, contributing to overall genome health. Also, very commonly, the Chawanprash, which also can be a very good genoprotective effects and a good candidate for various psychological functions. We also have been working on the age-related memory deficits, especially like Amalaki Rasayana and Rasasindura, which has very good potentials in the management of various psychological disorders. Not only that, we also have been tried with the Ayurveda Rasayana as well as the combination with the yoga in the cognitive aging. where we've seen that the combination of Rasayana as well as aging has shown very good results on the various neurological deficits. But also, we have been working, we also have a cancer hospital, the Integrative Cancer Hospital, where we are also trying to work upon on Rasayanas. And recently, we have been trying with Guduchi Adigrita as well as Vidari Kanda Adigrita as Basti in the stage patients who have been seeking with the conventional line of treatment. We also have been using the Guduchi to good effects and have been working on its potentials. And especially the Amalaki and its telomere biology have been studied, enhancing that there has been a potential. These are the various multiple studies that has been done on these products. Uh, Not only the various medicines products, but also some of the lifestyle modifications like yoga, like japa, dhyana, etc., which has been studied, and they have been found that they are effective in the various psychological functions, especially on anxiety disorders, especially the generalized anxiety disorders. I would like to just take some moment for how do we apply this on the mental health, especially the Medhya Rasayanas and his mental health. And there are different categories of Medhya Rasayanas which are good for the application in mental health. And if you divide them into their actions, we say that there are some Shitavirya and Madhurvipaka medicines like Yashtimadu, Brahmi, which are good in the retention of the cognition. Whereas in terms of grasping as well as in terms of the memory enhancement, we can always use those rasayanas which has the Tikta rasas and Ushnavirya drugs. So you can always try these combinations at different clinical scenarios, and we have tried to stage the age-related cognitive decline based on Ayurvedic understanding, and then probably we have tried various herbs for its good clinical effect, where the initial stage of the early cognitive decline has been correlated with the kapha dominant conditions, where we have tried with Haridra, Yashtimadu, it can be clinically used. In the second stage of like where there is a pitta aggravation, Mandukaparni, Brahmi, Haridra and Yashtimadu could be a good candidate. And in the third stage, where there is a chronic later stages of Vata dominant conditions, Amlaki, Haritaki, Jatamamsi and Guduchi has been tried. Whereas in almost all the stages, we have tried with other like Ashwagandha, Kapikachu, Kushmanda and Brahmi can be used in all the conditions of the age-related cognitive design, and this is what we have tried to publish based on the clinical outcome. A few of the of these applications how we have applied in as generating the evidence based especially I'll just give you 2 or 3 examples, especially on anxiety disorders and how we have been able to generate some form of evidences, especially at present we are undertaking a multicentric study on the treatment adherence and the tolerability of an Ayush product which is sponsored by CCRS, where we are trying its efficacy. It's mainly has the extract of ashwagandha, which is underway. And also we have just completed a study on the use of Brahmivati as well as Sastarishta as an add-on therapy in generalized anxiety disorders. So these are the various publications that we had in the last 3 to 4 years, especially on the clinical application that were done on is the utilization of these rasayanas in various clinical conditions, especially focusing on the generalized anxiety disorders. The other areas where we are trying to apply these rasayanas in the clinical scenario is insomnia, where we have tried to adopt an integrated model comprising of the Panchakarma, especially the Shirodhara, Abhyanga, and the Pada Abhyanga, the foot massage, and also the medication like Jatamamsi and the Brahmi are tried as like an integrated approach that we are trying to have the diet, lifestyle, intervention, as well as the drugs, especially in primary insomnia and various other. Similarly, we have worked on various PhD as well as PG work and the publication that we have done based on its clinical applications. So based on various single drugs that we have tried to work upon, and we have tried to see where it can be applied like as a clinical scenario, and various antidepressants like ashwagandha, brahmi could be a great potent antidepressants, like jyotishmati, the neuroleptics, ashwagandha, tulsi having a potent anti-stress, and these are all based on the various experimental and clinical studies that we have carried out at not only our centers but also other Ayurveda centers, like ashwagandha and jyotishmati can be a good adaptogenic. Kapikachu, the mucuna purens, can be a good anti-Parkinson's drug. So we have been generating good amount of evidences in these areas, and also to summarize few of its clinical applications, especially some of the, because I'm specialized in mental health, especially we have tried to see the application of these conditions, especially in 6 major categories of the mental health, especially in the psychotic disorders. We have been trying with various preparations like Kalyanaka Grita, Kushmandagrita and Panchagavyagrita, and we could see that especially in the water dominant symptoms, Kushmandagrita has a very good role to play. In case of Pitta dominant, the Kushmandagrita as well as Brahmigrita can be a good candidates. In Kaphaja dominant symptoms, the Panchagavyagrita are said to be good. Again, in Abhasmara also we have tried both at the acute stage as well as in between the, and again where we could see that Kalyanaka Grita, Brahmi Grita, and especially the Smriti Sagara Rasa has been found to be very, very beneficial. In insomnia and other sleep-related disorders, Sarpagandhavati, Jadamamsi, as well as Sahasrareshta is a good combination, as well as especially in the substance abuse. Again, we have developed a de-addiction center where we are trying to treat based on Ayurvedic rehab centers, where we are trying to combine the combinations of uh, yeah, yeah, and especially in case of anxiety disorders, we have been using ashwagandha, tagara, and brahmi, and in depression, jyotishmati, manasamitravati, and especially the purana grita, especially if the grita is stored for more than 1 year or even sometimes 10 years, it can be very good potent candidate for its usage in the various psychotic disorders. So to conclude, it is said as Nityam Hita Ahara Vihara Sevi Samikshakari Visheshu Asaktaha Dataha Samaha Satyaparaha Kshamavan Aptopa Sevicha Bhavanti Aroga. Like if a person has to stay longer, healthier, he should involve himself in regular intake of balanced diet and activities, being analytical, detached, mental equanimity, and have that forgiveness and respect the elders and teachers. He will be healthy and can lead a very healthy and happy longer life. Thank you very much.